So our business for the semester is community health nursing. And we have all had an aspect of community health nursing. We've had a touch of it at the diploma level. And so this is going to be more interactive. And so this course introduces students to, can Jennifer please stop painting my screen? Jennifer, please stop painting my screen, please. Stop painting the screen. All right. So it introduces us to the concepts of primary health care and the principles of CHIPS. It also introduces students to the community entry. Oh, this is to basic principles of hygiene and occupational health, and then safety. So what is the overall goal for this subject? That you'll be able to use the knowledge acquired in community health nursing to help the nursing profession. And so I expect that you should be able to demonstrate knowledge and understanding of community health nursing. And so this is evidenced by your ability to analyze the definition of community health nursing and discuss the differences in community health and public health nursing. Then you should be able to describe the concept of primary health, where you discuss the various components of primary health care and also explain primary health care. Then you should be able to demonstrate evidence of knowledge of basic principles of hygiene. And so you should be able to describe the various components of hygiene and discuss the importance of hygiene. And then at this level, you should critically examine reproductive health issues. And so you should be able to describe basic rights of reproductive health, discuss the principles of reproductive health, outline factors affecting reproductive health, and describe the Safe Motherhood Initiative program. And then you should also be able to demonstrate knowledge and understanding of child health care, which should be evidenced by your ability to outline the components of child health, discuss the integrated management of childhood illnesses, and then also discuss adolescent health. Adolescent health care. And then finally, you should be able to critically examine occupational health issues. And so you should be able to describe occupational hygiene, discuss work-related disability, discuss workman's compensation, and apply safety measures in the work environment. And so we are going to do 6 units, 6 sessions in each of the units, making 6 units 36 sessions. And the unit 1 talks about community health nursing briefly, where we discuss the differences between community health and public health nursing. We try to define what community health nursing is, discuss the principles of community health nursing, the role of the community health nurse, the qualities of a community health nurse, and skills in community health nursing. Then with unit 2, we look at the primary health care. So we talk about the history of primary health care, the concept of primary health care, the pillars of primary health care, elements of primary health care, challenges for implementation of the PAC, and then the community-based health planning and services. And then unit 3, we look at the basic principles of hygiene. We try to define hygiene, talk about the components of hygiene. Then we discuss the importance of hygiene. Then we zoom in into personal hygiene, food hygiene, and then environmental hygiene. And then we get to the unit 4 where we look at reproductive health in totality. And so here we will try to define reproductive health, talk about the principles of reproductive health, discuss the basic rights to reproductive health, the importance of reproductive health, factors affecting reproductive health, and then safe motherhood initiative. And then there's unit 5, we'll look at child healthcare, where we look at the definition for child healthcare, child health, the components of child healthcare, integrated management of childhood illnesses, adolescent healthcare, adolescent-friendly health services, and then school health services. And finally, we will look at occupational health, where we will discuss occupational hygiene and safety, occupational disease, ergonomics, disability and workman compensation, and then travel medicine, and then sports health. And so all these sessions and 30 all these 6 units and 36 sessions will be done by us, we the learners, and then the lecturer. And so the assessment, we have group presentation, 10%. The report writing will also take 10%. Individual assessment, which is made up of mid-semesters and unannounced quizzes and tests, 10%. And then the end of semester, which is 30%. What are your expectations? What are your expectations? What are your expectations? What are some of your expectations with regards to, yes, Elizabeth?
Please, I expect at the end of the course, I'll be able to be well versed with community health nursing issues and be well abreast with the issues of community health.
Okay.
Thank you.
Thank you. You're welcome. Let's see how it goes. Any other? Any other expectation? So all of you don't have any expectations. So you are just attending the lecture without any expectation. Somebody wants to build up knowledge on public health and apply them to, that is Maxwell. Yes, Idrisu. Fatal.
Good evening. My expectation is that after this course, I should be able to, if not all, tackle most of the community health problem we encounter in our various work sites. Thank you.
Okay, let's see how we unravel that. Any other? Any other? Okay, so let's see how it goes. And so as you don't have your expectation, my expectation during the semester is that you should attend lectures both online and inside. On-site is very compulsory. Read your student handbook. Then please use your official name as ID on the Zoom platform. Then when we are doing our presentation and you are absent, in person on the platform by the raising of hand. If you are not present, you earn 0 for the presentation mark. However, the report writing mark, you will earn that mark. Then, when you are asked to send your work by 5 p.m. before we start the lecture, and you send it 5:30 or after the deadline, the group will not be allowed to present. And so it means that you are forfeiting both marks, both the content and the presentation mark. So please take note of this. So I gave you an assignment on the platform last week for you to reading assignments about the difference between community health nurse and a public health nurse, or community health nursing and public health nursing. What did you find out? Let's set the ball rolling. Who is going to start for us? What is the slight difference? Yes, Raymond, your hand is up.
Okay. From what I got, I learned that public health nursing and community health nursing both focuses on health promotion, protection, and preservation of health through an organized community effort. And with respect to their differences, the public health is of the nation's focus, and with that one, the government is directly involved in promoting and protecting of health of the whole population. And with the community health, it focuses more on nursing in the community and protection of people's health. Thank you.
Thank you, Raymond. Yes, Richard.
Okay, so I also learned that as both are focused on the promotion of health and prevention of, but with the public health nursing is geared toward a larger population, say in the case of an outbreak of a pandemic or an endemic. But the community nursing has to do with nursing care rendered to specific individuals, family, or community, or a group of people. That is the differences I also get.
Thank you, Mauli. Yes, Lydia.
Sister, please, I also agree with them. And to add to it,
Lydia, you went
yes,
to read. You went to do your reading.
yes,
Mauli
please.
is in his house. Raymond is in house.
Yes, ma'am.
And you went to read.
Okay. Yes, ma'am. Please, I'm coming again. With public health nursing, it deals with the human beings in general, like if it's nation or the world at large, whilst the community health nursing is focuses on the community, maybe with maternal health care, child wellness clinic. These are the ones they look at, and then the public health nurses or the public health issues also are being taken care of by the public health care units, which sees to it that if there is an outbreak, they bring about measures to prevent the outbreak. Thank you.
Thank you, Lydia. Yes, Noah.
Yeah, madam, the community health nurse is normal concern with the welfare of the well-being of the community that he or she is serving. But the public health nurse services are broadly like the whole country or just the larger nation. So while the community health nurse is concerned with the welfare of the community, the public health nurse is concerned with the whole nation. So that is how I also understand it. Thank you, ma'am.
Thank you, Musa. Yes, Ishmael, your hand is up.
Please, madam. What I also got from the difference between the public health nurse and the community health nurse. The public health nurse talks about the general public, the health concerning the general public. Example, we can take a COVID-19 as a general public. Then the community health also talks about specific area or community. And that one too, we can also take example, the outbreak of cholera or anthrax. Recently, we have some outbreak of anthrax at some parts of Upper East region. So that is how I also get. Thank you.
Yes, Calvin. Thank you.
Thank you. Okay, me academically in Ghana, public health is you acquire as a BSc in university, where the community ones you can do it as a certificate course or a diploma course in colleges. Thank you.
Thank you. Any other issues? Any other? Because you went to read. And so I can say that everybody should tell me what they read. Any other? Yes, Idrisi.
Madam, good evening again. What I've learned with the public health nursing, those with a larger population, it can be reaching the country. But with the community health nursing, it gets focused, as the name stands, it gets focused on a particular community in which a health worker is working. For him to be able to identify the problem, then tackle them.
Thank you. Barikisu.
Sister, the community health nursing differ in area of focus. The difference is that public health nurses review historical records, scientific studies, and population data to determine how to prevent injuries and illness. But with community health nursing, it focuses more on the resources that the community members need in order to support their health and their well-being.
Thank you. Ibrahim.
Thank you, sister. In my personal studies, I also saw that the public health nurses, they deals with preventive measures, and that of the community health nurses deal with curative measures in tackling family minor illnesses and that of set of medications.
All right. And so thank you all for your contributions. Let's look at the people who don't normally want to talk, but they would like to put things down in the chat box. And so Georgia says that community health nurses provide direct patient care, health education, preventive services, and coordinate with healthcare providers to address the health needs of individuals. Public health nurses focus on population health, promotion, disease prevention, etc. Rahat. Public health nurses have a role in preventive care. Community health nursing deal with preventive care. Ali Awal Mohammed. Public health focuses on the scientific process of preventing infectious disease. Community health focuses on the overall contributors to a population. Vivian said, public health nursing also rely on the finding of community nursing to achieve their data. Charlotte said, public health nurses work with clinical settings and provide a wide range of medical services. Community health nurses work in community itself, etc., etc. And so I believe that all of us have an idea, one idea or the other with regards to community healthness. And so in simplicity, I will also say that the community healthness provides direct care in settings outside healthcare. And so they deal more in the homes, the workplace, the school, the clinic, and then other places that they will be assigned to. And then the public health nurse functions in the community-based settings, which is established to address health problems. But you realize that in practice, you might see the both of them handling so many things together. However, it's like in Ghana, if you go and do public health, you are put in charge of policy making and the rest. And so there's vast distinction. Like somebody said, academic-wise, and the community is a certificate, and then if I got the person right, the public health is degree or something. But I realize that the nursing and the midwifery council have even merged the two. These days, they don't want to bring distinctions because they realize that they have been doing virtually almost the same thing. And so this tenor 1988, too old a definition, and so I want you to also bring a current definition on community health nursing so that we will have a look at the two to see how it has changed with time. I intentionally brought this, the 1988 definition of community health nursing, which says that it is a field of nursing practice that blends knowledge and skill from both the nursing and public health sciences. And then they apply these skills and knowledge that have been acquired from the nursing and public health sciences to the promotion of optimum health for the total population. And so this is what tenor brought. And so next week, let's also come with a recent definition of community health nursing, and then we compare. I also bring my latest one next week, and so we compare. And so now that we have these groups, let's try and do this in the groups as well. And so what is the objective of community health nursing? And we are saying that the community health nurse is concerned with prevention of diseases in the population. The concern with the prevention of disease in the population. And so what are some of the principles, basic principle of a community health nurse? I am doing a brush on because I want to believe that this, you have come into contact with it during the diploma phase. And so appraisal of community, we are coming to discuss these one after the other. And so as I mentioned them, the one that you can explain, then you explain for the class with examples. Appraisal of community health. Identification of health problems, identification of causes of health problems, and setting priority for public health intervention. And so with this course, we are even going to apply the knowledge that we acquired, during introduction to community health when it comes to health problems and then certain priority for public health intervention. We are going to apply all these and then in discussing the principles of community health. And so when we say appraisal of community health, identification of health problems, identification of cause of health problem, and certain priority for public health intervention. What do we mean? When we say that, what do we mean? Let's get interactive and then move. What do we mean when we say that? Any witnesses? Anyone that is setting the ball rolling? You can choose any of them to talk about. Appraisal of health, identification of health problems, identification of the causes of health problems, and then certain priority for public health intervention. What do we mean when we say that? Yes, Jesse, your hand is up.
Please, madam, I will talk about appraisal of community health. So basically, when you talk about the appraisal of community health, it actually explains comprehensively the assessment of a community's health issues or the health status of a particular community, such as the needs and other health issues. And then with that, these information are being gathered in order to bring about an improvement in a plan, and also in order to improve the health status of the community. And also they gather the community resources, the number of resources that the community have. They get all this information in order to provide the best of service to a particular community. Thank you.
Thank you, JC. Elizabeth.
Yes, ma'am. Please, I will talk about the identification of health problems. The community health nurse, since they normally find themselves in working within the community, they tend to know or get familiar with the health conditions and the health problems facing the community members. So they are best in the position of identifying the problems that are facing or the community members are facing, being it housing issues or physical or psychological issues. They find themselves identifying these health problems so that they can stand on it and then find solutions to. Thank you.
Thank you. Yes, Richard.
Okay, sister, so please wait. I'm taking the identification of health problems. As we said, with the community nursing, they are rendering the nursing service directly to certain individuals, families, and group of people. And they do this in a collaborative effort with the community. So with that, interaction with the community help them identify the health problems in that particular community. Thank you, sister.
Thank you, Richard. Any other? Any other? Any other? Any other? Any other issues? Any other? Yes, Enyonam.
Hello, madam, please, the identification of the cause of health problems. In the community health nursing, because the nurses are within the communities, they'll be able to identify what is causing the health problems. For instance, if there is maybe a cholera outbreak, they'll be able to find the cause of the outbreak so that there'll be an intervention, or there will be something to be done to prevent the spread of the disease. Thank you.
Thank you. Any other? All right. And so we move. And so what are some of the functions and responsibilities of the community health nurse? The community health nurse knows the policy of the agency or the ministry he or she is working with. He knows that this is the policy with minor ailments, the policy. So you don't do your things anyhow, as if you are working for yourself, but you should know the policy. And you see, one thing is that sometimes in this part of the world, we ignore so many things. Sometimes we don't do what we are supposed to do, and then we do what we are not supposed to do. And I keep saying that there are laws in this nation. When you do something that you have not been assigned to do and you are doing it well, it's like everybody pretend as if they have not seen it. But immediately you do the wrong thing, that is when you realize that there are policies in the agency that you are working with. And as such, as a community health nurse, you should know these. You should know the policy that you are the agency that you are working with. You should know their policies. And then you should have a sound public health concept with regards to issues. You should have knowledge and understanding of diseases, knowledge and understanding of how to control diseases, epidemics, and so forth. It is your responsibility as a community health nurse to also be familiar, have a sound knowledge. So you are a community health nurse, and then you are asked about cholera, the mode of transmission of cholera, how cholera can be prevented, and it's like, I don't know. No, you should have a sound public health concept, knowledge with an understanding with regards to issues concerning community and then public health. Then we say that as a function and responsibility, you should be well grounded in social sciences. You should be well grounded in social sciences. The techniques of the interviewing techniques. You see, as a public health person, as a community health nurse, you work directly with people. You come into contact with people, that you do home visits, and then people come with their issues concerning health, concerning some form of disease or something that is mind-blowing. And so you should be able to have the skill of interviewing where you can probe further And so if you go for a visitation and you find out that a mother or a couple have a malnourished child, you should be able to engage them in a conversation such that they will be able to, you will be able to unravel the mystery or what their challenges are. And so you should be well grounded in social sciences, especially interviewing skills. Is very important to have interview skills. It is very important. Then you make periodic and continual appraisal. Periodic and continual appraisal. Just to realize that most of the time you go for performance review, so you should be abreast, periodic, continual, these sentinels, surveillance, sentinel surveillance, active surveillance, passive surveillance. You should be able to do all these. You should be able to do all these. And so that whenever you are called upon, you will be able to deliver. And then as a function and responsibility of a community health nurse, you should know where and how to get aid. You see, sometimes you are placed in the community, remote community, you are the only person there, but then you should know when, where, and how to get aid. If there is the need to refer a client to a bigger facility, you should know where to get the aid in terms of transportation, in terms of the referral. You need to know where and how to get it. And so when you visit most of the community people, the community health nurses there, they know a transport owner, they know a person in the community who will even wake up in the middle of the night to help them with services that they need. They know that, yes, if I have to refer somebody, I have this kilometers to refer the person to. So you should know where and how to get the aid. And then establish community activities is one of the functions and your responsibilities. Establish community activities, engage the community in sanitation programs, engage them in health promotion programs, engage the community. So you need to establish activities together with the community leaders. And so this brings us back to community entry, mobilization, and engagement. And so as you go in there and then you mobilize the people, you engage them in activities, you are able to sustain the community and also help them with their needs. If you think that you are in the northern part of Ghana and there is this outbreak of anthrax, and so as a community person in the community, you should be able to organize an activity to talk about anthrax, how to prevent it, how to recognize the signs and symptoms of the anthrax. And so you should be able to establish community debates, should be able to engage the community in the communal labor. And so all these things are some of the functions and responsibilities of a community health nurse. And so what is the role of the community nurse? You provide antenatal care, you provide maternity care, you provide postnatal care to ensure safe pregnancy, delivery for the mothers and the child. So we have the community midwife, we have the community nurse, you provide under 5 clinics, you provide clinics for treating adults and children, for minor ailments, you do referral of major illness, you do health education, you provide facilities for teaching practice, and then you promote the use of local health services in the community. And so if one is nearer you, you encourage them to use instead of them going far away to use local health services. And then you also help them by teaching them how to use local products that they have in the community to prepare nutritious diet for the community members. And so the area of their jurisdiction, they can work in the homes, the communities, the CHIP zones, the schools, the workplace, the clinics, maternity homes, and whichever place that they will be assigned to, they will go and then work. And so what are some of the qualities that a community health nurse or a community officer should possess? We are also going to take this one after the other. And so take the one that you want to talk about. When we say a community person should be a risk taker, what do we mean? That you should be knowledgeable in terms of disease and health. What do we mean? You should have the ability to adjust, the ability to function independently, the ability to be creative, ability to make scientific decisions, and you should be an educator. Take any one of them and let's get interactive as we discuss this. Why should a community health nurse be a risk taker? Why should you be an educator? Why should the person have knowledge when it comes to health and disease? Yes, Ishmael, your hand is up.
Please, madam, I want to tackle the ability to function independently. On that basis, the community health nurse must develop certain level of competency and certain level of courageousness so that he can stand in public, then speak, and then more to the point, like he should be more knowledgeable to know certain things. He should learn the basic ones so that in the absence of his or her seniors or the superior, he can stand and work. At least if he will not be able to even administer all what he have, he should be able to do the basic ones on his or her own. Thank you.
Thank you, Ishmael. Yes, Raja Kakari.
Yes, sir. Please, a community health nurse must be knowledgeable in terms of diseases and health, in as such that the nurse must know the causes of some of the diseases.
Oh, your network
in her community. And hello, Ma, please, can you hear me?
Yes, now we can hear.
Yes, so I was saying the community health nurse must be knowledgeable about diseases and health. She must know the causes of some of the common diseases that are in her community, and to be able to know some of the preventive measures that can be taken into action that can help to prevent the diseases in the community.
Thank you. Elizabeth.
Yes, Mama, please. I'll talk about a community health nurse being an educator. Most of the time, because the community health nurse lives within the community and more of the time liaise and relate with the community people, most of the community people see the community health nurse as having a lot of knowledge. They see them as, let me say, a role model. They know that they have a lot of info. So whatever the community people think they need to know, they will come to the nurse to ask. So you have to be able to be in the position to teach them so that they'll be able to get the knowledge they want to better their lives. Thank you.
Thank you. And your name?
Okay, madam, please. Mine is public health nurse must be creative. When we say public nurse must be creative, means that as we are already discussed, a community health nurse educates, does so many things. So whenever you want to do this a kind of education, you have to be creative about it. So, sometimes creating these slogans that are catchy and attractive, you can sometimes even create a song or something. So you have to be very creative so that you'll be able to attract people to listen to whatever you want to say or come to maybe a function or something like that to be able to gain knowledge, and then so that whatever you are doing will be impactful. Thank you.
Thank you. Samuel.
Doc, please, I'll also speak on the ability to function independently. Please, I think as a community health nurse, you need to have the ability to do so in the view that there may be a situation where you will be the only health worker present. And in effect, you need to be a critical thinker to work on your own and not to be dependent on others. Thank you.
Thank you. Stephen.
Okay, I also talk about the risks. As a community, sometimes you'll be sent to deliver your task, maybe at the thick forest, or you need to cross a river before you reach your people. So you must bear any risks that will encounter.
Come again, Stephen. I think
Okay.
the last bit you swallowed it, so I didn't get it.
Okay. I'm trying to say that as a community owner, sometimes you need to cross a river or pass through a thick forest before you reach the people who are going to perform your task. So as a community nurse, as a community health nurse, you should be able to swallow any risk that will be encountered in your course of your work.
Okay. Thank you. Raymond.
Please, I'll take the consumer of research. In order for the community health nurse not to be outmoded or outdated in their rendering of care, they need to be familiarized with the current trends of research and new inventions relating to the nursing and other disciplines they are working with.
Thank you, Raymond. Any other? Which one haven't we tackled? Jesse, your hand is up.
Please, madam, I'll also talk about the ability of the community nurse to adjust to situation. Mostly, I will talk about community. Let's say you're going to carry out a research or something in a particular community. And then this demands of you to actually go to the scene. And as a result, you have to engage with the people. And then with that, in reference to community entry like this, you have to be able to be like the people. You have to mix yourself with the people in order to gather the necessary information. Sometimes you go to these communities and then there are even no better place to sleep. There are even no better food to eat and all stuff. And as a community health, once you've chosen to be in that profession, you should be able to, get yourself involved in everything in the community in order to provide the best of service to your community. Thank you.
Thank you, Calvin.
Sister, I wanted to talk about the adjust. It's the one that is left out, but I think JC have said everything already. So.
Okay. Thank you. Let's look at those chatting. Let's look at those charting. Fitnet says that risk taker must be prepared to take risk in most of his or her decisions prudently. Then a risk-taking community health nurse is open to try new approaches and solutions to address complex health problems in the community. Then Maxwell says a community health nurse being a risk taker involves carefully assessing the potential benefits and drawbacks of different actions, making informed decisions, and being open to innovative solutions. Another risk taker, somebody says education, knowledgeable to identify some common signs of and symptoms, and so independent. Did anybody talk about being independent? The community health nurse being independent. Did anyone talk about that? I don't want those chatting.
But please, I'm the one who talk about it.
Okay. So thank you all for the contributions. So let's move. We are making progress. Let's move. And so, what are some of the skills in community health nursing? You should have a skill aside the role that you have been given, aside the functions and the responsibilities that you have been assigned as a community health nurse. You should have these skills. You see, it shouldn't come to you. It's like it should come to you, rather. It should come to you without sweat. You should be able to exhibit these skills any day, anytime you are called upon. And one of the skill is interviewing skill. Interviewing skill. A community health person should have the skill of interviewing at his or her fingertips. You should be able to ask questions, the right questions. You should be able to probe further to get the right answers. That is the skill of a community health nurse or a community person. You should interview people. When you interview them, you should be able to delve deep, to probe further, to get the needed responses that you want as a community health nurse or as a community person. Then public health speaking is a bonus because you are organizing debates, you go to functions as guests, you go to you see, you are an educator, and so public speaking shouldn't be a problem for you as a community person. Whenever you are called upon to come and say something, come and speak in public, you shouldn't shy away. It's a skill. And I don't know if you have ever seen them before. They can talk. They can, you see, public speaking is not a problem to a community person. Because you organize thereby in the community, you are always leading people, delegates to the chief palace. You normally serve as the Ochiame or the linguist for the group that come into the community, and then you are taking them to the chief or introducing them to protocol. You sometimes become a gatekeeper and all those things. And so public speaking shouldn't be a problem. Public speaking shouldn't be a problem. And so it's a skill that you should acquire. So if you're a community person here, or you are aspiring to be a community person, and maybe you are shy, then learn the rudiments of public speaking. Learn how to speak in public, because it is part of the skill that you should acquire. And then counseling, the skill of counseling. Counseling is not giving people advice. There's a difference between giving people advice. There's a difference between teaching people what to do, and a difference between counseling. You see, when you are counseling somebody, you tell the person the pros and the cons. You give them the do's and the don'ts. And it is the person's responsibility to, out of whatever you have counseled him or her about, it is the person's responsibility to act on them. And so you counsel them, you tell them about the decisions that they have taken, the pros and cons of their decision, and they make a choice. That is what counseling is all about. You are told, and then you make a choice, the skill. And so these are skills that comes to the people naturally. If you're a public health person, these things should come to you naturally. You should be able to interview with all the necessary interviewing techniques, such as being able to probe to get the right information, using all the senses when it comes to interviewing people, looking at them, looking at their verbal and their non-verbal gestures and all those things. When it comes to public speaking, you should be able to stamp on your authority. Normally, when people fumble during public speaking because they are not so much knowledgeable. They are not so much knowledgeable in whatever subject or whatever information they are giving out. And so they fumble. But then you should be abreast with current issues concerning whatever information you are given. And then whenever you are, sometimes you are not prepared. Sometimes you are sitting somewhere and then you are called upon to come and do something. You should be able to do that. Sometimes they say, Mommy nurse, Papa nurse, come and say something about this disease condition, how to prevent these conditions and so forth. And so it's a skill that should come to you in such a way that you'll be able to deliver any day, anytime you are called upon, and then you should be able to counsel people. And sometimes it's so funny and interesting that you think you are counseling people regarding diseases and prevention of diseases alone, but sometimes you can also be called upon to do a little bit of social counseling. Any questions at this point? If you have any contributions, if you have been involved in public health speaking, if you have acted as a community health nurse or a community person in a community, let's all share knowledge and ideas. Any contributions, any questions in the next 15 minutes? Let's okay, Ma Raymond, your hand is up.
Sister. Hello.
Yes, Raymond.
Yeah, please. I once learned that the right of every person ends at his nose, and relating it to this one is like the roles of the community nurses. We've mentioned many. I want to know their limits, like in rendering all their services. What are some of the limits? Like where can they get to? What are things they do not need to like perform as part of their services?
Oh, Raymond, we are missing you. I didn't get the last bit.
Hello, sister.
Raymond,
Hello.
your line is breaking.
Please, I can hear you. Can I speak? Hello. Hello.
Yeah.
Raymond, your
We can hear.
Raymond, your line is breaking.
Okay, so I wanted, then I'll type it in the chat box.
Fatih, please mute yourself. You are disturbing us. Raymond, please unmute and talk.
Hello.
Uh-huh.
Please, I was asking you mentioned lots of rules and responsibilities the community health and public nurse render to the society. So I wanted to know their limits, where their role ends, things they do not need to do when like rendering their services to the community.
Their role will end where your policy ends. You get it? You
Okay.
realize that
Yes,
much
please.
as you have these functions, much as you are operating in the workplace and so forth, you are operating in the homes, your role will end with your policy. That's why we said that the community head and community person should know the policy of the agency or the ministry he or she is working with. You are there to protect lives. And so somebody will ask, so if I go to the community, if I go to a house and some couples are fighting, what should I do? Will I encroach on their rights if I try to talk to them? What do you think will be? Yes, class, I've raised this. Let's get interactive. What do you think? That you've gone to do home visitation and one household, they are fighting domestic violence, and you as a community health officer, what will you do? Donald, are you coming to answer this or you are coming to do another thing? Ahmed, your hand too is up.
Good evening. I would say that it will be part of your responsibility in relation to the counseling that you just brought. At least it's also part fighting within the community would also affect one way or the other their health. Because if there are some certain things the man should provide, because of fighting with the couple, he won't provide it. At least it's part of your responsibility to counsel them so that they will stop the fight, or you will settle them, and then they will come back to the reality or what you are going to give. So I think it's part of your responsibility in relation to the counseling. That's what I have more.
Okay, let's hear what Linda has to say.
Okay, sister, the question that you asked, we've encountered some before. We went to one visit, and then the couple, they were fighting. So normally, when you are in the community, they know you are a nurse there, and then when you go for home visit, whenever they see you, it's like they are shy. So the shyness even put, by the time you open your mouth and say something, you see, say things are okay a little bit. So you just call them to.
So when they were fighting, what did you do? You have hands-on experience.
Yes, when we went, they were fighting.
Your line is bad, though. So Linda, please start again. The line was so bad. I didn't hear.
Sister, please, I'm saying.
You have hands-on experience. So what happened?
Hello. Sister, please, can you hear me? Hello? Sister, please, can you hear me? Oh.
I can hear you.
I hear you. You can speak. Okay. I was saying when we went there, immediately we entered the house, we saw them fighting. So when you're in the communities, like they give you some sort of respect. So when they saw us, they was like, the nurses are in. So everyone was back. They were going back, and then we went there and what was happening. So each one was trying to explain him or herself. So we asked them to come to the fight. So they stopped the fight. They came to the facility, and then we involved the clinic committee people, and they came and they solved the issue. That's all. Thank you.
Please, what if I ask you what?
It seems Madam is not even on the thing.
Yes.
Assuming they didn't listen to you, what would you have done?
We will still go to the community. We have a clinic committee. In the community, yes, they created a group of community at the facility. So in case of this, you call them and then they will come in. So things will be okay.
So would it have been proper, like if they still refuse, you reporting them to the chief? Is it proper?
It's not the chief. It's like we have a committee. The chief has created a committee at
Okay,
the clinic.
okay. All right.
Within the community members, the elders. So we just inform them. Then they come
And they'll
in,
come
and
into
then
it.
if they
All
are not
right.
of them, they report the
Like
thing to the chief.
she is saying, for the meantime, because they look at you to be like someone who is a stranger to them,
and
definitely for the meantime,
I'm
even if they will carry it some time ago, they will listen to you.
Senior
They will
Umar,
listen
you
to
see,
you, but
sometimes,
maybe even if
sometimes
later on they will do it, they will do it. But
what we
immediately, if you
encountered
talk
is
to
that
them as health workers, they will listen to you.
yes.
you know, Senior Umar, sometimes
respect. Oh, the nurses are people.
Yeah.
So you see, madam, you see this thing, okay, calm down. Let's solve these things. Then we call the clinic committee people. They will invite them, and then
with the clinic, you know, some people, they are very temperamental. Even if they see you, whatever they want to do, they will still do. They won't even shy.
oh, okay. But what I encountered with them, when they saw us,
They be okay. Yeah.
Thank you.
Any other issues?
Mommy, I'm coming to talk about the limitations my brother raised. This is Donald.
Yes, we are listening.
Please, regarding the limitations, as he said, if you go out into the field, for example, into a school for like examination to assess students in a particular situation, then you come across an illness that is beyond you. You have to refer to the clinicians to take over. It's definitely a limitation on the part of the community health nurse who doesn't do a clinical treatment. So the fellow refers to the next person to take over from there. That's why it's a collaborative work. Also, we have issues like made mention of the anthrax. You suspect an outbreak, then you have to report to the appropriate authority to take over from there. You can't just go and tackle it yourself. So some of the limitations, you have a way out. It depends on how you handle it.
Thank you.
Yes, Idris, your hand is up.
Yeah, madam, I'm coming about at my setting. What I've seen is a problem, but it's like the people are seeing it. At my place here, mostly you see the girls as early as 12, 13 years, they'll be pregnant. And the funny thing is, if you report the case to the police station, you see that they'll and pick the case back from there. I don't know what they will tell the police. Then the case will die there. So with this situation, what do you do now? And most of the things is if they come back at the clinical, it will be like a child taking care of child. A lot of you here and there, even the money to pay to is. Hello?
Jackson, your hand is up.
Yes, madam. I just wanted to respond to the last comments by brother who is talking about teenage pregnancy. If I'm heard loudly in class, I just wanted to say that I think the idea of reporting such cases to the police would just be attempting to address the symptoms as a community health nurse. Really, I think if you have an issue such as that in your base, it is important that you really engage the major stakeholders of the community and try to find out what exactly is causing it. Ordinarily, the police officers there are also just community-based service providers. But as soon as you move on to report activities like that, they are going to become defensive. And the change you would seek to implement would already backfire. So I think that if you have a peculiar situation like that, you will want to engage with the opinion leaders. Like a sister spoke earlier and talked about a clinic committee. If you have a similar establishment, you would want to start from there. And to get to see, do they have access to education? Do they really understand that? Do they see the teenage pregnancy as a problem? If they don't, and you see it, then it then depends on you to take that up as a responsibility and educate them to realize that there are better ways of living rather than getting pregnant at that age. And you probably will be well appreciated than if you confronted by exposing them to the law enforcement agencies. Thank you.
Do you expose people with teenage pregnancy to law enforcement? Okay, let's hear from Idrisu Fatah before we talk about.
You engage the leaders, and they've seen the norm and per the rules. If I think you happen to taking care of a client of such and something happened and they take you on, you yourself is more or less a crime you are doing, because you've seen a crime and you are not reporting the crime. What then is your duties now?
And so you believe that the community officer should be able to report the crime?
The thing is here is like you engage the leaders. They are virtually doing nothing about it. And you see, if something is happening, we are all trying to cover our head. Assuming you are taking care of the client of such and less maternal mortality, most of them they come with low and something happen and they are coming to audit you. At the end, you can't defend yourself fully. Thank you.
Okay, thank you. But we haven't exhausted it all. You've gone for home visits. Somebody was asking, where does the community officer end your responsibilities? There are numerous functions and responsibilities. So where does it end? Linda, your hand is up.
Sister, please, I want to say something about what my brother just said. It's like teenage pregnancy in the community. We have midwives there in the facility. So this one, you go for school health. There you get the adolescent. When you go to home visits now, they are shy because their parents are there. Normally, they don't want to open up. So when you go to home school health, you see giving health education, talking to them, you get their views. What is the problem? What is going on? Even someone will tell you, Madam, I don't have pad. My mother don't give me even money to buy the toilet roll. In this case, what am I supposed to do? So you come to the facility, you call the let's say the girl to come to the facility. You talk to her, you call the parent, we talk to them. If still the parent is not supporting the child, you call the clinic committee. The CHNs, that's what I know they do. We are there with them. Clinic committee, we call the parent. This is that the child's need, you are not supporting. Then if still there's no improvement, the CHN then report to the public health nurse at the district office. Then they will take over.
Okay, so
it's not like when a girl is pregnant, report to the person.
In the
No,
community,
we have process.
You try to address the situation in the community. And then if the situation is not solved, that is when you also take it up to the next level.
Yes, please. Yes, please.
And so now my next question is, Jackson, your hand is up, so let's also listen to you. Or is it the old hand?
Oh, no, it was a follow-up. Thank you. I think that my sister who just spoke hit the nail on the point. At the beginning of I think somewhere in the middle of the lecture, Madam mentioned the core roles of a community health nurse and talked about your knowledge on what we call the standard operation procedures, what the national program is vis-a-vis whichever topic you are going to encounter in the community. So you have this at hand and you are unable to address it at your level. There is another level above you. The rest could be occasioned, but not by you. Remember, you are based in the community. And Madam's question about a home visit where you encounter a fight, before you can intervene in that situation, you should have established some level of trust between yourself and respect and the community members. So if your first action in a particular situation, once is teenage pregnancy, is exposing them and reporting them, it will be difficult to get their cooperation going forward. So I think it's necessary that you get every community chief's compound is reporting to a district. So you would want to scale it up to that level and engage them in thereby. There's a bit of layers you can exhaust so that if there's a need for arrest, it's occasioned by people above you. That is if it becomes necessary at all, so that you can still continue to have their cooperation in addressing other health issues. Thank you.
Thank you. And so you are apart from Linda, who encountered this domestic violence, apart from Linda, who else also have encountered something, not necessarily domestic violence, but resistance to seek health, to seek for health and help in the community with regards to an underage child? The person is underage and then the person is sick, but the parents are refusing to oblige you, the officer, from helping the child. Who else have encountered such situation? Mm-hmm. Does it mean that you people are not community people? All of you are working in the urban facilities. Jackson, your hand is up. You see, with this course, please, those of you who have encountered certain situations in the community, you need to come out. We are sharing experience. And so this course, we are going to draw so much on the experience of people who are on the field, especially when we talk about primary health concepts and then the CHIPS compound and all those things. And so let's get interactive. Let's get interactive. Let's listen to Daniel. Let's listen to Omar. And let's listen to Ansbeta. Let's listen to them. Then
Yeah.
Jackson will close for us in summary.
Yes. Good evening.
I've told you since level 300 first semester, when we greet for the first time, we don't greet again. Daniel.
Yes. Sister.
Steady.
This time, so like over 2 years ago, I went to a town in the Eastern region called Latekuyapem. Yeah, so I had a friend there who's a community nurse there, and we were chatting. And he said there was like a rape case on a 7-year-old girl. And during the investigation, they saw that the person who raped the little girl was the uncle. So they couldn't report the case to the hospital and to the police. Later, they brought the child to the hospital for treatment. When they brought the child to the hospital, the father came back in less than 5 minutes and took the child back home. That in their family or that community, when such things happens, they take it to the shrine for whatever. And sister, they said they did everything possible to convince the father to bring the child so that they can at least even check whether the child is having an injury or whatever, and the father refused. So they just have to allow the father to take the child away. So that's the experience I also had during that about 2 years ago.
Thank you. Yes, Ansbeta.
Sister, please, I also encountered an issue like that at Bremai Sikuma, where we had a 12-year-old girl who came in bleeding. She came to the emergency bleeding per vagina. So after taking the history, I think when we were taking the history, she rushed to the washroom and we followed her just to go and see an abortion. So they initiated the abortion at home and she was bleeding and the fetus wasn't coming out. So it's when they brought her to the hospital that the fetus now came out. And when we took the history, we realized her father's best friend raped her and she got pregnant. And because the man was taking care of her, they didn't want to report the issue. But when they got to the hospital, we sent them to the maternity and getting medications and stuff became a problem. We wanted to report, still the girl's father said that was the best friend, so he didn't allow us to report the case. And I think the girl died. So when she died, I think she needed some medications and transfusions that because the man wasn't taking care of her at the hospital couldn't. We also did our part picking people's medications for her. At the point, we didn't have blood and other things. So when she died, the father now, someone spoke to the father that he could sue the hospital for us not taking care of the daughter and the daughter died. So the father with someone's support went to the police station. The police came in. It was a whole lot of issue and the hospital administration came in. So at the end, I don't really know what happened. So with that, we go back to the question. We didn't know whether you were supposed to report without the parents' consent or you were just to leave it how we left it at the emergency and it went and created a problem at the maternity unit. Thank you.
So we still come back to the fact that where should the community health officer responsibilities and roles end? And so we come back to the fact that the officer should be knowledgeable with regards to the policies, the agency's policies, one. And then realize that somewhere in the functions, the responsibilities, we said that the community officer should know when and where to get aid. And so much as you might not want to destroy the relationship you have nurtured as a community officer, you should know when to get aid for the people you are working with. Jackson, please summarize for us so that we can leave the platform.
Okay, thank you so much. So I happen to work in the eye care space, and there was this young girl who had a needle prick at home, and I think that from where I work, I'm here in Tamale. The cultural orientation is that if a known relative commits act and you straight away go to the hospital, the consequence will be that person will get handed over to the police, and that will mar the relationship at home. So they kept this child at home, and then when the eyeball was about just literally speaking getting in, then somebody who is a Samaritan of a sort brings this child up. And so it became necessary that we would have to eviscerate this eyeball and put in a prosthesis to save the other one. Then these parents who earlier didn't show consent suddenly appear. And then their view is that when we touch that child with a knife, culturally, the child was going to die. But we are aware that as a minor, it wasn't on them to take entirely the responsibility of deciding whether their child should take care or not. So we have a social welfare department. So we got our social worker to reach out to the regional office, and we had an official cover from them, and we did a surgery just to save the child's life and the other eye. Eventually, the parents, having seen the outcome, became remorseful, and then they showed up, and apparently they were appreciating what we had done. So I guess ours had a good ending. Thank you.
Thank you, Jackson. I have a question here from Maxwell.
Okay.
That is it true that only when you have worked in the rural areas as a community health nurse, that community health nursing is friendly? I think this is a myth. He's asking whether it is a myth. This is a myth because the first person that worked in the rural area, or the first person that was posted from an urban place to the rural area as a community health nurse, the person didn't have experience. The person had not worked in rural areas before. And so you cannot say that the community will be friendly to you. It is how you enter the community. Cast your minds back to introduction to community health. Cast your mind back when we were discussing community entry, and we said that it is initiating, your ability to initiate, to nurture and sustain a working relation. And so it's not about you having been able to successfully live in a rural area before community health can be friendly, but your ability to nurture and then sustain a relationship, a working relationship. And so as you go into the community to work, having it at the back of your mind that you are going to work with people, and most especially when you are posted in a rural community, you should know that the rural folks are more sensitive to certain issues than people in the peri-urban and the urban communities. And as such, whichever thing that you are doing in the community, you should be mindful of that. That is why reporting or not reporting is very dicey. You work with the community people, and as such, you realize that there are structures in the community, such as the traditional structures, the religious structures, as well as the community structures themselves, and even the democratic structures where you have the unit committee and the assemblymen, etc. And so realize that in every community, there are certain rules or there are certain ways of solving some of these issues. And so as a community health nurse who knows where and how to get aid, it is not always the case that you should take the aid or the help outside the community, but you should recognize the community structures in the community and how they operate within the community, such that when you encounter such situations, you allow the norm in the community to take place, and then you take it up from there. And so in the community, as a health officer, you need to work hand in hand with the structures in the community. This is when you do that, you'll be able to deal with many of the challenging issues that even the police couldn't have handled. And so it still comes back to the fact that as a community officer, you should know the policy, because the policy is your guideline and it tells you when that's your freedom or the role and the responsibilities and the functions you are operating in the community ends. And then based on that and being abreast with the fact that you should know when and where to get help, with regards to certain situations, you should also know when to get the social help for the community member who is in distress. And on this note, I want to thank each and every one of us for a fruitful lecture today. We've had a very fruitful interaction, and I believe that next week we'll also have a wonderful interaction. Next week, we're going to deal with the concept of primary health care. And so in your various homes, please take opportunity and read about primary health care and the CHIPS, community-based planning services. And so that when we come next week, we also have a very meaningful discussion. Thank you. Enjoy the rest of your weekend. Bye-bye.
Bye, Mom. Thank you very much.
Okay, see you next Friday.